I'm Shelley Chandler. I'm with the Association for Community Providers in Iowa. I'm excited about having summits like this and hearing about what other states are doing and have done, because in Iowa we're really good at talking about things, and it's much more difficult to actually move off the dime and move things forward. So I'm very pleased today to moderate this panel to have you hear about what is being done and what we are doing to move forward from a state perspective, so how that affects you in your daily lives. I'd like to start by introducing each of the panel members, and then we'll start with Sherry, who wants to go first and get off the stage as quickly as possible. So Sherry Becker is the Executive Director of NIVIC Services in Mason City. She's got over 25 years of support employment experience in Iowa. She's served as the Iowa APSE board member for 15 years and is a past president. She's currently a member of the National APSE Board and the Iowa Employment Consortium. She was honored to receive the 2009 Wendy Wood Award from APSE and the 2010 ARC of Iowa's Administrator of the Year Award. She got her undergraduate degree in social work from the University of Iowa, date to be left off, and a couple years ago, not in June, and her master's degree from Drake University. She's a certified rehab counselor and a certified psychosocial rehab practitioner. And as a CARF surveyor, she's provided employment services consultation to over 50 community rehab organizations throughout the United States and Canada. LeAnn Moskowitz is currently the Program Manager of Management Analysis for the Department of Human Services at Iowa Medicaid in the Bureau of Long-Term Care. She's got over 20 years management experience overseeing residential and vocational services for nonprofit organizations serving people with developmental disabilities, mental illness, and other special needs. She has a bachelor's degree from Iowa State in sociology and a master's in public administration from Drake. We welcome LeAnn. Got too many papers here. Rie Kennedy-Lizotte has worked in public and private sectors to provide community services for people with disabilities for over 30 years. She currently serves as project manager of SELN, the State Employment Leadership Network for the National Association of State Directors of Developmental Disability Services. For the past 3 years, she's provided direct technical assistance to 24 states, DD agencies, and partner state agencies in developing effective employment systems by maximizing state and federal resources through improved rates and payment systems, using data to guide daily program management and system performance, sharing resources of both time and knowledge, and providing ongoing technical assistance and training. She was previously the program director for provider development in the Georgia Office of Developmental Disabilities, where she helped home and community providers develop capacity to serve greater numbers of Georgians with developmental disabilities with quality services. And last but not least, John, who's left the stage but is coming back, is the Director of Employment Systems Change and Evaluation and a Senior Research Fellow at the Institute for Community Inclusion. He's the Project Director for the State Employment Leadership Network, Principal Investigator of Access to Integrated Employment, and a 20-year national data collection project on day-to-day and employment services for people with developmental disabilities funded by the Administration on Developmental Disabilities, and directs research and technical assistance initiatives focused on employment and transition from school to employment. John has over 30 years of experience as a manager of community-based day and employment services. He's a trainer, consultant, and researcher. His interests include organizational and systems change, employment outcomes, employment policy, natural supports, person-centered planning, and program management. Without further ado, I'll turn it over to Sherry.
Thanks a lot for having me. I am Sherry Becker. I'm really happy to be part of today, but I got to tell you, this is nerve-wracking being part of this lineup today. I mean, this is a big special day for Iowa Employment First, and I'm honored to be here, but I'm a wreck. At any rate, here we go. As I said, I'm the director of NIVIC Services. I want to give you a short overview of NIVIC. NIVIC Services is an employment organization located in Mason City, Iowa. We have about a $4 million budget. We serve almost 450 people a year with 48 staff. We serve 9 counties. We fulfill our mission of helping people work through 3 business models. Affordables and Affordables on First are thrift stores. We also have a work center. which is located in the industrial park. It's a fairly traditional segregated model where we outsource work from area businesses and subcontract with them and provide paid work training. And then we have JobLink, and JobLink is our community employment division, which is located downtown. I'm going to share with you some of the lessons that I feel like I've learned since our organizational change project started. The mediocre organizations are always at their best. That's been up on the wall in my office for years and years. But our changes really began in 2007. The motivation for our change, or our sense of urgency, if you will, if you read all the books on change, came from a lot of different environmental factors, and I've tried to list some of those. Ironically, the initial discussions in our organization were driven by concerns about our business operations, not our services. However, you can see that both sides of our business had a lot of pressing needs, and that's what drove us to change. We knew, and I think we all know, that in order for a business or an organization to thrive and to grow, they have to change. So we decided that maybe it would be easier for us to be proactive rather than reactive, so we started doing some things. The other thing is that our business operations heavily subsidize our community employment services, and we've been committed to community employment for a long time, not to the degree we are now, but I started supported employment in '86, actually came to NIVIC after I got my master's at Drake to start a program for people with severe and persistent mental health issues. So we've been doing this kind of thing, but we really stepped it up now. So without our business side, truly, we wouldn't have the margins to subsidize the mission. Engaged leadership. In an effort to revitalize our business and services, we received a technical assistance grant from what was then CRP, RCEP, University of Missouri in Columbia. Like my good friend Pat Steele always says, you can't be a prophet in your own land, don't even try. And so I think bringing somebody in from the outside is the truth. It really helps. Our activities were actually, I think, based on John Cotter's book called Leading Change. He describes 8 stages. I realized after I put this presentation together, when I sat down there agonizing today, that he talks about 8 stages, and I'm going to tell you about 7 not so easy lessons learned. So I either missed one or combined some or haven't reached it yet, at any rate. As part of the process, we put together a group of leaders in our organization, people who could withstand the pushback, people who would model the behavior, people that would guide the change that we wanted to see. This guiding coalition of people, Kelly's here today, she's head of our JobLink services, was a very cohesive team. They took a leadership role in terms of everything that we did. They didn't just do it in the organizational change meetings, they did it in their daily work, and it made a big difference. It's certainly apparent to everyone that if you want to sustain change, leadership has to model that behavior, because words without deeds mean nothing to anyone. And so this was important to our process, but more important than that was the fact that the way we changed, we took this process and we now have driven leadership down and required at all levels of our organization. Everybody has a chance to be a leader within our organization, and I say that very literally. A lot of the people think that the only changes in the organization, and I'll talk about the staff later, were for the staff, but for a control freak like me to give it up, it was major. It was really major. The commitment of resources was a big thing in our organization as well. Keep in mind that our margins were decreasing, we were in financial trouble, we had to do something, and so the board actually voted to take on this project. We had not a lot of staff capacity. We committed to 6 meetings, and all 40 full-time staff people in our organization participated in that. And it was a big deal. Actually, 2 days we closed. That's unheard of, because what happens to billable time? But we took that effort, we closed the organization, and then the other days we'd meet 2 days, and then half the people would work, half the people go the day, and then we'd switch it up the next time. It was very calculated, deliberate manner to get everybody involved. And I continue to believe that that ability to involve everyone provided the foundation for the achievements we've made so far. It's also important to surround yourself with like-minded people, people who think like you think. And I'm preaching to the choir today because you're all here. I do want to tell you, though, you are here, and I think that's really exciting. And if you're not a state member of our AFP or you're not an APSI member, you should consider joining, because it's really important, because we want to have events like this, and they're going to, part of our membership dollars would go to that. So that's my plug. Let your customers call the shots. We began by taking baseline data. John would love that. We took a lot of data. Our staff actually completed a very comprehensive organizational effectiveness survey. They had a lot of great ideas, and they were pretty critical of how we're performing. We actually now do that. We've continued to do that every other year because we get such great information from it, and then we write goals for improvement. We also did a lot of focus groups. We got Sheila Stokel to come over, and she met with all kinds of people, and so did our consultants. Almost 200 people met in meetings, and we asked them things like, what do you think we do best? What do you think we should start doing? What should we stop doing? What should we keep doing? It's not surprising that most of the people said, beef up your business. Start acting like a business, not a rehab organization. That would be our business partners. Other partners told us, you have to do more community employment. Like, you talk about it, but you need to do more of it. Other people said, stop doing sheltered work. There were a few family members that actually said to us, we don't want to see any changes. We like what's happening. We like sheltered work. And I was talking to a friend about this, and he reminded me of a quote by Henry Ford. And Ford said, if I had asked people about what they wanted, they would have said faster horses. So I thought that was pretty good, actually. We used the input that, from all these people to change our mission. We had a mission that sounds awful now, but at the time that I helped develop it, I thought it was fabulous. It said, caring staff providing inspiration. I'm like, I don't know. Now our mission says, talented teams empowering people to achieve employment. Not a lot of wiggle room there. We know what we're doing at NIVIC. Our new mission clearly states that we have the intention of becoming financially independent, and that we want to expand our business opportunities so that we can reinforce our commitment to helping the people we serve get meaningful, gainful employment. We spent a lot of time evaluating our services and our business projects. We developed a written strategic plan with measurable goals, deliverables, timetables, accountabilities, milestones, very specific. I know it's not rocket science, and I've done a lot of strategic planning in my career, and I've helped people plan, but this plan is a working document that's really very much connected to what we do in our daily work, and it makes a difference. We measure and we report results to everybody. We try to make it very meaningful to our customers, because the change is only meaningful if it's appreciated by the beholder. One of the most positive benefits that we had from this whole process, from the technical assistance, was the increased employee engagement and communication. Having everyone participate in these meetings, like I mentioned before, increased the buy-in, and it set a high expectation for performance and accountability. We have staff who were initially very uncomfortable. They'd love it if they saw me squirming up here today. Anyway, but they were very uncomfortable to get up and report out in front of the other staff. And now they're not only doing it, they're good at it. So the confidence level of everybody in our organization has improved. We also dramatically improved our marketing efforts to expand stakeholders. We did a lot of activities this month. You know, October, National Employment, Disability Employment Awareness Month. The gal that was at Culver's on the first slide, she's one of 2 billboards that we have up in North Iowa now. We also learned that when you feel like you can't afford to do any marketing, you need to do marketing. And so we've really kind of made a commitment to that. Organizational redesign is where the rubber really met the road, because we weren't just talking about philosophy anymore. This is when we started talking about people's jobs. We talked about changing their jobs. You know, it's change is good, you go first. Like, nobody wanted to have their job changed. Like, their job was important. And so we really had a lot of discussion around doing this. What we finally decided on, based on, again, keeping in mind we wanted to increase our business margins and we want to increase our employment outcomes, our staff were serving 2 customers. And we decided you can't serve 2 customers well, so our staff are now divided into people whose primary customer is business and people whose primary customer is individuals receiving our services. I think this is critical for the future too, because as we continue to move forward, we're really going to have 2 separate business models. What we hope to do is place people that seek our services, but be able to, through effective, efficient business models, offer like temporary employment opportunities for people throughout our community who have barriers to employment. So we can sort of be that, let's fill in the gap. Like you need a job today and you go to the workforce, maybe you can come work for us until you find the job. That kind of thing. That's what we're thinking. We might change it, who knows, because we keep changing things all the time, but that's where we're at right now. Our culture changed and it's still changing. We encourage risk-taking, non-traditional ideas, activities, and actions. This slide features our staff at our Christmas party last year. We wanted to save money. We wanted to make the event, our dinner dance, more intimate. So the staff got together and actually served over 250 board members, family members, consumers at Christmas. It's really a great, I think, example of the initiative they have and also of servant leadership. We've been empowering our consumers for years, but now we're trying to empower our staff and our teams as well. Success builds momentum. The changes we made have created better performance through customer service and productivity-oriented behaviors. We really changed everything up. Our business achievements include the Kaizen event. We hosted a week-long Kaizen event with our largest business customer, Currys. They're with Assa Abloy, largest door manufacturer in the world, located in Sweden. It was a great event. We learned lean strategies that we apply. We just had a retreat a week ago, and now staff want to have mini Kaizen events in all our departments so we can improve what we're doing everywhere. We've made a conscientious effort to employ people with disabilities to be an affirmative employer. And these just aren't people working at minimum wage. They're making more than that, retirement, the whole deal. We're going to walk the talk. We expanded our networking and our marketing efforts. I mentioned marketing earlier. As far as networking, I go to a lot of meetings now, and business has a lot of acronyms just like us. Like I'm going to tell you that I am a member of APEX, but I can't tell you exactly what the acronym stands for. I know it's about inventory control, though. We now have training through Iowa State University, CIRUS. They're the ones that are consultants to all the industries and businesses throughout Iowa. So we hang around with those guys so we can be business-like, and because we get to know them, we have relationships with them, and we can use that in our business. As far as services, we've done a lot in terms of our services. We implemented the discovery process. We have expanded the customized employment. We've committed more people to job development. We developed curriculum-based trainings with NIAC. The discovery and the curriculum trainings have been an important part of our change because what they did is they provided people in our segregated settings a way to be part of the community employment outcomes. You know, when this thing first took off, there was a lot of scuttle about, well, not everybody can work at JobLink, and what are they going to do with all the rest of us? So what we're trying to do is transition those people into a new role. And discovery really has helped improve our outcomes. And now it's a buzz. I know it's a buzzword, but everywhere. I was just at the store the other day, and a consumer said to me, you know I'm in discovery, so you probably won't see me here very long. We also have a big focus on transition. The students who are graduating now, you know, have been integrated all through school. They have no desire for a segregated setting. We also expanded our opportunities for community participation because we did have a lot of people, and we've known a long time that when people get a job in the community, they miss their friends and they want to be with them. We also leveraged partnerships in new ways. We have a Voc Rehab grant, and so that lets us have a couple job developers who are itinerants, who work from their kitchen tables, working with people, the library, in underserved rural counties. We have expanded our Ticket to Work activities, and we also have a bundled service contract with our county that has just the primary focus of getting people competitively employed as soon as possible. This year at NIVIC, for the first time, the number of people receiving services in the community in competitive employment, the general workforce, is more than the number of people who are employed at our stores and our work center. It may not seem like a milestone for you guys, but it's a big deal to us. Thank you. Kelly and her team should take a bow, but there's a lot of people who played into that. I just went over the outcomes before I came. 65% of the people are working more than 20 hours a week, and 83% of the people maintain their employment. Maybe that's 83%. Is that the number of people who get a job in less than 6 months? And retention 78% or something. Thank you. I could see her back there like, hey. Truth in reporting, right? We keep looking for opportunities to change the system, our structure. We're always trying to reinvigorate the process with new projects, themes, and change agents. It's exhausting, but it's exciting. I'm going to share this slide with you to conclude. I love it. For us, organizational change has not been a light switch. It's a journey. We all have alligators to manage, but employment-first activities like this summit remind us that we're all here to try to advance our purpose, employment in the general workforce for all Iowans. Thank you.
Thanks for everybody coming today. This is an exciting event. I feel like I'm the person up to my rear end and alligators being the Medicaid person in the room. But there's a lot of exciting things going on, and getting to be part of the employment efforts in Iowa is really exciting part of my job, and takes me back to my first love of making sure quality services are provided to people who need them when they need them. There are a lot of exciting things going on, and I represent the Medicaid agency, so I'll be talking from the Medicaid perspective and what we do for people as far as employment supports and some exciting things that are going on. I'm sure you've all heard about the mental health redesign going in the state, and yes, this is like the 4th, 5th, 6th time, I don't know. I've only been with the state for a little under 3 years. So my understanding is there's been a lot of redesign efforts at the state level across the years, but this year we mean it. The legislators committed. and it is true, and we really hope to make some positive change, and it's the perfect opportunity for us when we're looking at redesigning the system to really take a hard look at how we've been providing employment supports to people and how we can improve those things and change our system so that we align with our employment first philosophy that integrated competitive employment is the first option for people in Iowa. So I'm really envious of Utah, I mean, wow, what a fluke. So, hopefully we can garner the same support, and I'd also like to see us adopt employment first legislation. So. With that in mind, some of the things that we do right now in Iowa, and we don't give ourselves enough credit as a state. We've got a lot of awesome things going on, and we're recognized nationally for our efforts in improving the lives of people with disabilities throughout our state and throughout the different areas of the system delivery. So, we have Medicaid for employed persons with disabilities. The Medicaid buy-in has made huge changes for people in their lives, giving them the opportunity to maintain their benefits while continuing to increase their earnings. And that's a big fear for folks when we heard people talk earlier, am I going to lose my Social Security? Am I going to lose my other benefits? And so it's important to know that there is a program available for people who do have gainful employment, and it enables people to retain their income while maintaining benefits and not losing that safety net that the benefits of the Medicaid state plan services provide to folks. So with that, Medicaid is an insurance organization. Typically your Wellmarks, your Blue Cross, Blue Shields, those types of organizations don't provide employment supports. But fortunately, we're able to do that through the home and community-based waiver programs. And so we are able to do that in our 1915C waivers, which would be the brain injury waiver and the intellectual disability waiver are the two waivers that we currently offer the employment supports. And then we also have the Habilitation Services Program, which is a 1915I, which is a state plan service. So although it's waiver-like, it's an actual state plan service that anyone who's qualified for Medicaid can actually access that service if they meet the income guidelines and the functional criteria for that program. So with that, under the waivers, we do have pre-vocational services that are available to folks to help prepare people for work. And that is the intent of pre-voc and has been the intent over the years. We've used it differently here in the state in response to the needs of folks, and it has been a journey, and we're at the point of the journey where the tides are changing. And so we're going to be looking at pre-voc and how pre-vocs used differently going forward. Supported employment is a huge support that's available for folks, and within supported employment there's the activities to obtain a job. So some of that discovery work that we're talking about, job development, going out and doing some customized job development, and activity to maintain employment, that job coaching, that on-the-job support. For folks. We also have consumer-directed attendant care available under the waivers that can assist people and provide them with that one-on-one personal care that they may need while they're employed. We also have transportation services available under the waiver. Transportation is a huge barrier for folks for competitive employment. And transportation being available under the waiver to help people get to and from work is a great asset to them and helps people obtain as well as maintain employment. It is, you know, we still got a long ways to go. We haven't addressed as a state our rural transportation issues. Folks who live in rural communities don't necessarily have the benefit of having 4 or 5 taxi services or paratransit or regional transit authority to call upon for transportation. And so I think with this system redesign, it'll be really important that we address the transportation issue. Transportation to work. If you're a Medicaid eligible person, we have transportation available as a benefit to Medicaid members for medically necessary covered services. So if you need transportation to your doctor's appointment or something like that, you can contact TMS and arrange for transportation if you're a Medicaid member. However, that does not include transportation to work. So, and that is, like I said, often a barrier to work. So with the mental health redesign, the principles are founded on the Olmstead Plan. And if you haven't looked at the Olmstead Plan, you need to. Employment is peppered throughout the program or throughout the efforts. And it's not only the Department of Human Services plan to come into full compliance with Olmstead. Services are in the community, what people do during the day, where they live. It's also addressing the other state agencies and how they'll come into compliance with that as well. So with that in mind, that's forming the foundation of our mental health redesign. It's a perfect opportunity for us to take a hard look at what core services are we going to provide as a state to folks, and that those really need to include employment, and employment in the community as the first choice. So there are a lot of public hearings going on right now about the redesign, and the final recommendations to the interim committee were due this week. And there will be recommendations out online by November 1st. I highly recommend everybody go out and look at those and make sure that the employment interests have been clearly communicated in those recommendations. What else do we have going on? We have Money Follows the Person, which is a demonstration grant that will continue through 2016 with the opportunity to continue through, I think it's, Brooke, 2020. But a great thing that they were able to do recently was hire an employment specialist who will help people with that discovery and development piece. And it's a great opportunity for us as a state to build provider capacity, to build those discovery and development skills, and to get people real jobs in the real world. So we're excited about that. And again, the Medicaid infrastructure grant, we were granted, I should say, supplemental funds. And with those supplemental funds, we're going to continue our efforts to enact systems change for employment services. We're working with the State Employment Leadership Network to evaluate our funding structures and evaluate what other states are doing with funding and rate methodologies for employment supports so that we can incentivize competitive integrated employment for providers. Whether it'll be what Oklahoma's doing or what Oregon or Massachusetts or Minnesota, we don't know yet. We're not there yet. We're kind of in the tree, you know, looking at the trees, not necessarily walking through the forest. We'll get there. But we're really excited. It's a perfect opportunity to have input, and it's a perfect opportunity to really take a look at what we're doing and improve it. So I'm excited about what's going on. During the next year, we're going to spend a lot of time doing feasibility studies through the Medicaid infrastructure grant, and taking a real hard look at the feasibility and the benefits of adding benefits planning as a service under the waivers, because we all know that's, you know, an important aspect of people's work lives is that assurance and that strategy of how to be competitive employed, increase your earnings while having your safety net of your benefit package. So I think that's all I have to say. Oh, well, I shouldn't say that. Medicaid has also recently provided us with some very important guidance and regarding the 1915C employment support services. And really, it's not changing the federal regs. The federal regs have not changed. What it has done is given states clarity in what the intent of the regulations were so that we can design our waivers and our services appropriately to meet that intent. And so we do anticipate that we will be changing our core service definitions, but we're going to align with the core service definitions that will come out of our mental health redesign. And a lot of the efforts that are going on over at MHDS with our folks, partners at the CDD, working with the SELM, you know, it's just a perfect opportunity to really evaluate and change what we've been doing as an organization. And I know, you know, people read the pre-voc clarification, that letter, and are a little fearful. However, I think be assured that the state recognizes there has to be functional and meaningful alternatives for those folks who don't want to work. And that needs to be a phased-in approach to our changes. So we're not going to throw the baby out with the bathwater. And we certainly want that input, that partnership, and that collaboration as a state as we move forward to make positive change for folks.
But I want to tell you a little bit about the influences that have helped CMS step up and recently release the new guidance to states. And the guidance, as LeAnn indicated, is not new legislation, but rather how to help clarify what the intended implementation expectation is of CMS to states. So you will all find in your packets no PowerPoint from John and I today, and my conversation will segue to John's. There's a document in your packets called Medicaid and Employment. CMS has been doing a lot of discussions around the country, and certainly Iowa has taken full advantage of what is allowable and what can provide resources to states through the different Medicaid programs. There was a 2009 ended a demonstration project called Demonstration to Maintain Independence and Employment. CMS is very proud that they put out grant funds for this. And what they got out of it is clarity on the key issue that when individuals work, their health costs go down. And CMS likes that a great deal as a healthcare insurance company. So they lean on that demonstration project, and when they talk about implementing changes within their structure, they use that finding. So they actually do something with what we're telling them. The Medicaid infrastructure grants have been going on from CMS. They've been happening for 11 years. It was really to support the Social Security's Ticket to Work program to help people with disabilities get back in the workforce. Employment first, that's what it was all about. Now there's a lot of implementation challenges, and we still are working through that. It takes the state government to actually implement. Feds make really good general rules and legislation, and they do that because we have a real strong commitment in this country about state rights. So here in Iowa, you are just at that point in time where you can really influence and put your state rights foot forward and create more employment for people with disabilities here in Iowa. So that's the Medicaid infrastructure grant. You certainly have the Medicaid buy-in. Iowa has taken full advantage of that as well. Have you implemented it in a way that has fully accomplished what you want to accomplish? I'd say not yet. It's laid incredible groundwork. It's created that swell of chaos. If you are a chaos theorist, you know that the more chaos, or when you get to break point of chaos, change really happens. I truly believe Iowa is at that chaos point, so go for it, guys. So I want to get more into the detail of the technical guide changes in the 19C program. I can tell you proudly, and I will say this proudly, that the State Employment Leadership Network, done 2 years ago, was our first engagement with CMS around some discussions. SELN states wanted to just talk openly with some key leadership within CMS about what could states do in partnership with CMS as a whole to promote employment. And that led to the challenge back from CMS to the SELN states, which spilled over to the State DD Agency Association that I'm with, saying that, well, help us think about it. CMS doesn't change legislation. Congress does that. But if you can help us think about what we can change or articulate better in our rules and our guidances, we're all for that. So we, as SELN, took up that challenge with CMS. That spurred a lot of attention across the country from provider associations, from all kinds of advocacy associations. TASH, APSI was at the table. The SELN and NASD as a whole put out some recommendations to CMS that help spur the guidance that's now out. We've spent 2 years, we talked about Kansas taking 2 years to get things to where they needed it. CMS took 2 years to get it out, and there was a lot of nudging, constant contact, constant challenge. Why, if you say you're gonna do this, why haven't you done it yet? CMS told us that they would take our recommendations into consideration, and they'd be used for the technical guide revision, they call it 3.6 that's coming out. They delayed that when the Affordable Health Care Act got passed, but they just recently, the date, I should know this in my head because it was such a grand day, September 16th this year, CMS put out an informational bulletin. That meant that they figured out a way that they didn't have to go through all this great brouhaha that happens in federal agencies, that it got out to more people in the field as a whole and not just out through the Medicaid state agencies. State Medicaid agencies often got the guidance from CMS, and operating agencies in states didn't always stay in step with what those guidances were or information. LeAnn knows this well. So you're lucky here in Iowa in that your Medicaid office is also your operating office for implementation of your Medicaid waiver services. So that's a real plus for you guys. But in other states, that's not the case. And so there's a lot of disconnect in the system about what is possible and what states really decide to do. There's a whole lot more possible, and as I was listening to everybody give quotes today, the one that kept coming in my head, and I will not quote this correctly, but I always keep it in my head. It's the Alice in Wonderland story, where Alice talks about with the queen that she can't think of what's possible. I mean, she's just lost in possibilities. And the queen says, well, I think of 10 or 20 or whatever her number was, impossible things before breakfast every day. Impossible things make things happen, so keep dreaming and do that. But people don't know of real possibilities. We say so often at the provider level, and I've been a provider, I say this many times myself, but CMS makes us do that. Or when I was working at the state level, I'd say, well, CMS makes us do that. Well, the truth is states' rights really can have a whole lot more influence over what CMS lets us do or not do. Their rules are actually pretty open in the grand scheme of things, and there is a whole lot more possibility than we've taken advantage of in this country. The guidance is out. CMS has taken a very clear stand, and this crosses populations. I sit, fortunately, it's a great opportunity for me on a CMS work group for improving employment outcomes throughout their whole system. So this guidance was, though it's the home and community-based waiver for the 1915C waivers, which mostly affects people with intellectual and developmental disabilities, they took into great account how this would impact across populations. So stay tuned, guys. This is just the beginning from them. But they put in a preamble in their section on core service definitions that employment is a critical part of adult life, and that it is an expectation and home and community-based services that people work. They say it much clearer than they ever did before. It's not just what they knew was a possibility or what they were allowing as a possibility, but they're saying, hey, states, pay attention. It's not us. It's partly you that's not getting this done. So they also put in some comments around promising and best practice. A lot of discussions around the states and the country around, well, is support employment better? Is peer-to-peer support better? Is customized employment service better? Should one be a core service and not the other? Well, the truth is it's employment services, and all those are strategies that are very effective, and depending on the individual you're working with, you might want to apply those practices. CMS is saying loud and clear to states, pay attention, best practice is important, don't eliminate things. Co-worker payments can happen under Medicaid, so don't forget that as an option. That's a possibility if your state rights chooses to do that. So there's a whole lot out there that Iowa can do in your redesign and relook at your core service definitions. They brought forth the clarity between the ticket to work challenge and ticket payments versus Medicaid payments. There was this always big scare out there as if a provider becomes an EN and takes ticket payments, does that mean that they're duplicating services and they'll get bumped or gigged on their Medicaid payments? Well, the truth is that's not accurate, and CMS says that much clearer now. They've added to the core definitions. They've divided supported employment into two services: individual employment services and group employment services. They've clarified that group employment is between 2 and 8 people, and we are forgiving those states who interpreted group employment to be 1 to 30 groups. CMS is paying attention, guys. Luckily, you in Iowa didn't do that, so you're in good shape on that. And they added a new service called career planning. there's a great bit of challenge when states argue over or haven't worked out the good collaboration that can happen between voc rehab and Medicaid waiver services. And career planning allows for the opportunity to help people prepare to get to the doors to VR, so that VR doesn't say, well, you're not employable yet, or any of those kinds of challenges and sort of diversions that happen. So career planning is out there as an opportunity for a separate service definition for those states that were really stuck in that argument about it. And it allows for things to be included in that, such as benefits planning. So might you say, is that a duplication with the benefits work that's done under the Work Incentive Act? Well, no, it's not. And you can define it as things that give people the general information about benefits management. When you're first introducing work to someone and they're scared about, are they losing benefits, that's important. So before they actually get to the job search or all of that, the benefits manager can help them know that there's possibilities, and then they can move on to the other services not paid by CMS. So those are some of the highlights. We will make the bulletin available. Sue Ann said it'll be posted on the website later, so heads up on that. The other couple things that CMS really applauds themselves for moving employment forward with is the Money Follows the Person grant, and Iowa has one. It allows for enhanced rates in states. Iowa is the first state in this country, so kudos to you, to have CMS approve under 100% administrative funding. That means the state didn't have to put up any of their own state dollars to hire a state lead coordinator in improving employment outcomes for people, not just receiving the Money Follows the Person grant resources to move out of institutions, but CMS is telling other states in the country that Iowa is organized in a way that their coordinator, so hear this, your expectation from them is that you're going to use that opportunity to help move your infrastructure in the state forward for all Iowans, not just the folks on the Money Follows the Person grant resource program. So challenged, your expectations are high. And then I listed on the back of that sheet all the other current Affordable Care Act things that are promoting employment. There's a great deal of conversation and work that's going around the Balancing Incentive Program, the 15I state plan options that'll help multiple populations, not just the IDD population. Pay attention to something that's coming out and not very well talked about yet, which is called Section 1915K, Community First Choice Option. That's a state plan opportunity that takes out the requirement for the prior institutionalization demonstration. It means that you don't have to be coming from an institution to participate in Medicaid waiver services, or home and community-based waiver services, I should say. So that's an opportunity for Iowa's redesign as well. Enough on Medicaid. I know my time's getting short, but I want to mention a couple other federal things that are going on. Another kudos to Iowa. The Administration on Developmental Disabilities has put forward major resources for projects of national significance. 6 states were awarded the grants, Iowa being one of them. They're just kicking off. The Institute for Community Inclusion at UMass Boston is the TA center under that project. So they're putting up money to improve employment outcomes for students transitioning out of school. And it's really about getting in early, and it's about strengthening collaborations in states. So we're not just talking about signing memorandums of agreement and then walk away and do our own thing, but we really work on collaborating and blending and braiding and organizing policies across systems and all that good stuff. So that's a great opportunity, and Iowa has been one of the states to have the grade to receive that grant. ODEP has put out a toolkit for employment. They think that's their big push and their federal support of Employment First. And everyone can access that. You just go on their website, and they're beginning to build the resources for that. It's all the practice stuff. So what else did I want to say? The Work Incentive Act reauthorization is up. If you're not part of the discussions going on, there is a great deal of discussions. The draft WIA legislation has some controversial language in it, or if you come from the perspective it's controversial, I don't know. It did include some new titles that promotes employment for transitioning students, and it ups the expectation of voc rehab systems across the states where they're engaged with students coming out of school into employment outcomes at an earlier age and a more aggressive or assertive process. It also challenges us in the country to derail students going right from school to any segregated services. It says that students must have trial work opportunities in this country. So we'll see where that goes. That's not been introduced yet, but it's possible that it'll happen soon. It's due. There's legislation called the TEAM Act, which is the Transitioning Towards Excellence in Achievement and Mobility Act. That's actually been introduced at the legislative level. There's 3 components to that. One's an education component, one's called education, employment, and empowerment. All of them change different pieces of federal legislation. The idea, it changes the Rehab Act, and it ties for the first time. It's quite interesting, and state DD agency directors talk about this a great deal. State DD agencies across this country operationalize a whole lot of long-term supports for people with IDD, and we do not report directly to any federal entity. We make up our own rules. So this TEAM Act would tie some responsibility of state DD agencies into the ADD and administrations so that we'd be tied more closely to what the USIDs do, what the PPNAs do, and what the DD councils do. So that should be interesting. It's introduced. What you can do is know about it, learn about it, talk to your legislators, make some decisions. Your voice is important, and never underestimate your voice. Legislators and legislative staff need to understand what you know and what you think. They don't have your experiences. They don't know what you know. So get out there and talk with them. And don't be intimidated by them. They're just like us. And then there's the newest bill introduced that could greatly influence employment in some people's perspective, and in other people's perspective, it doesn't matter. It doesn't get in the way. Those of us that have thought of it getting in the way, I don't want to say us because I'm changing my perspective on this. There's a new bill called the Fair Wages for Workers with Disabilities Act, and what it does is a revision or a recommended revision to the Fair Standards Labors Act and excludes the 14C certificate program from the Fair Labor Standards Act. What it does is phase out that 14C program over a 3-year period, and right now that's kind of the talked about discussion, so you need to weigh in on that. What it says, it's really a simple legislation. And in the grand scheme of things, as we've learned from Kansas, the simpler you can make legislation, the more likely it is to pass. And this is the first time the whole issue of the 14C certificate program has gotten to a level where it's not in complicated legislative language, but it's pretty simple. And what it says is it's phasing it out over a 3-year period. When the bill or if the bill's enacted, immediately there's no new certificates authorized in the country. At the end of the first year of the enacting of the act, it would mean that all publicly held certificates, publicly held entities, public entities that hold certificates would no longer have them. Then it falls into the not-for-profit world last. Those profit entities would have to phase out in year 2 and then not-for-profit in year 3. So that's getting a lot of steam on the Hill. I was quite surprised. It was introduced bipartisanly, so it has both Republican and Democratic backing. It was introduced by Representative Stearns and Bishop, just so you know that. And I got an email earlier today that there's several other legislators that are signed on it, and the Senate is watching this very closely, so heads up on that. And I'm going to pass it on to John.
And my part's the state's part, and as I thought about it, really what I want to say to some extent is driven by something Tricia said earlier today, which is unless you have something behind the legislation, nothing will happen. So the key question is, like, what do you need to do now? You guys have talked about it a lot. You've got some strong grassroots coalitions. You've had a really strong focus on employment in things like your Olmstead plan. You've got a stronger focus on employment in your Medicaid agency than in most Medicaid agencies. You have the opportunity of the current redesign to try and fix some of the things that are getting in the way from a structural and funding perspective, and you're going to need to be clear about what those things are. Currently, we know nationally that most states haven't done a very good job of moving employment forward as an agenda. And nationally, the number of people supported in integrated employment has stayed level, has not grown at all since about the year 2000. And we know that about 20% of people nationally who get developmental disability services specifically receive integrated employment services, and actually in terms of people working, the data we've got suggests it's between about 14 and 17% working, as opposed to just like getting job services that are moving towards work. But some states are really different, and you've heard from Oklahoma. They're a state that's really different. Vermont is really different and is above that 20% rate and has a much stronger focus on employment. State of Washington is really different and has numbers very close to Oklahoma's in terms of the percentage of people that are being supported in integrated employment. And actually, Washington's current numbers are about 59% working in integrated jobs, both individual and group-supported employment jobs, in any given week. Over 25 states have some sort of employment first initiative. About 3/4 of those have some sort of state policy or legislation, and I would say that's a place that you guys need to move. You've got the grassroots part of it, and if you want to get a feel for those other states and what their initiatives look like, the SELN website, seln.org, has an index to all of the states with links to their plans or policies or whatever documentation exists. About 14 states have some sort of official policy or legislation in place. You guys have a good base for that. You've got an employment plan that has a statement that says Employment in the general workforce is the first priority and the expected and preferred outcome in the provision of publicly funded services for all Iowans with disabilities. I'm also of a simplicity frame of mind, like that would be a great policy statement if you can bring it up to that level. But you need to get that guidance at a level, legislatively, policy, that can push the decisions about the details, like funding and training and the way service plans happen and those sorts of things. So what does it take to implement, what do you need to do? What does it take to implement it? I'll point you in part, and in the 5 minutes or so that I have, we won't get real detailed, but on the back of the SELN handout that's in your packets is a little diagram that says elements of high-performing states. And the simple message, well, maybe kind of both simple and complex, is states that are higher performing states, states that have created a focus on employment that has paid off in terms of more people working, have a consistent message about employment and a consistent emphasis on employment in each of the critical elements of how their service system functions. So, you know, those elements include leadership. To what extent is employment one of the first things that leaders in the state talk about when they're talking publicly about what they care about and what they're working on? Linda Rolfe in the state of Washington will never be in a meeting without talking about poverty and the importance of employment outcomes. It's about strategies, and that's policy. It's about having concrete goals. So the Alliance for Full Participation goal is that the number of people in integrated employment will double by the year 2015. That's a concrete goal. It's measurable. They picked it for a very specific reason, because it's pretty easy to say that can't happen. They picked it for a very specific reason, and the specific reason is we need to make revolutionary change here. We've got to behave differently day to day if we're going to create these kinds of changes, like Sherry's program. You can't just do it a little harder. You can't just job develop a little harder and expect to make significant change. And if you set your goal at 1% a year, 2% a year, you don't have to do anything that differently. If you're going to set it at doubling, you got to really rethink what your investments are and how you use your people and your resources. It is about finance. The other part about policy, and a good example is the state of Oregon, is what's important in your service planning process. What gets paid attention to? What's the role of case managers or service coordinators in creating change? The state of Oregon has spent the last 2 years retraining service coordinators with a focus on employment. They've created a set of what they consider pathways to work based on where a person is on the pathway. So there are people who want to work and aren't working yet. There are people who aren't sure if they want to work yet. There are people who have decided they don't want to work, and there are people who are working but should be thinking about what their next career step is. And they've started to create a set of tools that help service coordinators guide conversations with people and their families and their support structure based on which pathway they're on at this point. So how do we create policy and structures within service planning that makes employment real and makes employment clearly a priority in the way that that Olmstead statement talks about it being a priority? Financing is part of it. It's more than just what the rate is, though certainly you got to be paid well enough to make it not against your interests to try and support someone in individual jobs. You got to be able to not go bankrupt. But the financing structure is also how services are defined. The financing structure is also what the contractual expectations are. In Massachusetts right now, each of our employment providers is required to produce a 5-year plan for how they're going to transform their organization so that they can end up with stronger employment outcomes. That's built into their contracts with the state, and they had to deliver those plans about 2 weeks ago. It's about investments made in capacity development and resources. Rich Luking some time ago said, actually in one of his books said, regardless of motivation, the motivation, skills, experience, and supports of the individual job seeker, the ability to get a job too often depends on the effectiveness of the employment specialist. And one of the areas that we've done research in is, what do job developers do? And we know a lot about what good job development is. It involves networking and good career planning or discovery, and negotiation, customization of jobs. But when we ask job developers as part of a national survey what they do, only 33% of the respondents said that they use personal networks of the job seeker to find job leads. That flies in the face of what we know about what good job development is. In the state of Connecticut, where we're doing job development training right now, we surveyed, one of the questions in a survey to providers was, how do you do career planning? And a full 2/3 of them said career planning happens in the individual service plan meeting. That's not career planning. You know, career planning is a much more detailed process than what you can do as part of a mandated service plan meeting. We need to think about how to build our capacity, how to reinvest in that kind of training. The state of Washington is where they are in part because through all of the ups and downs of funding in the last 30 years, they've sustained a commitment, an investment of about $1.5 million a year in community training, primarily focused on employment. There is no other state, I know, that sustained that kind of investment in training, but I think they have a more efficient system today and a more cost-effective system today than they would have if they hadn't continued that training investment. And then I'll just say, well, two other things. Interagency outcome data is a big part of it. What are you accountable for? I think one of Sherry's slides had the "what gets measured gets done" quote on it. I think one of the first things that this state needs to do, that Iowa needs to do, is know how many people are working and how much. It's not just how many people are working, and are they making good wages? Are they working enough hours? There's no infrastructure for answering those kinds of questions at this point. I think if you're going to really make a step towards improving employment outcomes, you got to create a base for knowing what those outcomes are so that you can engage in the conversation in a rational kind of a way and know how you're doing. And interagency collaboration, and I'll actually say collaboration much more broadly. I think the risk of this moment in time for Iowa is there are so many balls in the air, particularly with the redesign. There are so many different groups working on employment as a priority that if you don't bring that energy to one place and figure out how to hold it together, there's a risk of decisions being made that will have unintended consequences and will take you in a different direction. So I think really that point of collaboration in terms of resolving some of the interagency issues you guys have struggled with over the years, but also really using the current opportunity is going to be a really critical part. States that have been successful in achieving high levels of employment outcomes are states that have a consistent employment message across each of those parts of their system. It's not about any one thing. I think the strong message from SELN states and from states we've done case study research with is its consistency of message. So, thanks.
Thank you very much. We do have a couple questions, but we're already over time. And I haven't even given you my opinion yet, so. One of the questions that was asked from your perspective, what can Iowa do to foster better collaboration between waiver folks and VR? I think we've talked about, and sounds like CMS has helped provide some clarity in that area. So we need to pay attention to the clarity that we've been provided. And then folks wanting to know more about the transition project that Iowa was recently granted. Is the DD Council the primary entity that was awarded that grant? So Becky's in the back of the room. I'm sure that they have a lot of information on their website and would be happy to answer those questions for you.